Hi, I am Sheena Perloxtero, fourth year AB Community Development student from the La Salle University, Dasmariñas. I will be presenting to you my study on eliminating HIV stigma. Philippines has the fastest growing HIV epidemics in the world, with 57,134 cases recorded from January 1984 to July 2018. According to Dr. Joselito Feliciano, Director of the Philippine National AIDS Council or PNAC, majority of the newly infected were likely to be teenagers and young adults, aged 15 to 24 years old.
As many as 32 people were diagnosed with HIV every day. Majority of the cases were HIV infections transmitted sexually, and the other means of getting the infection, such as sharing contaminated needles or from birth should a mother be infected with HIV. There were also among males who had sex with males, which the DOH or Department of Health refers to as MSM. The number of people with HIV or AIDS may be higher, as current data was only showed based on the individuals who get tested in health centers. Community based organizations and advocates of HIV, such as Love Yourself and the Project Red Ribbon, urged people to further discuss issues about HIV and AIDS to remove the misconceptions about the virus and to prevent it from spreading. Advocating and those people living with the virus share their stories in a bid to end stigma and discrimination in the country, since many of those who are HIV positive chose to remain in silence and anonymous. Knowing our own HIV status is the first step in our battle to end HIV and the stigma related to it. HIV stigma in the Philippines is caused by the cultural conservatism of the country, ignorance about the virus, and close mindedness of the people. The objectives or goals of this study are the following: 1. Provide education on how HIV or AIDS is spread and ways to protect themselves from it. 2. Promoting openness regardless of their HIV or non HIV status to break down and stop the stigma milieu from individual to community level. Lastly, encourage the people living with HIV to disclose their status and be the speaker to uncover the silence surrounding PLHIV and empower them to treatment adherence. I will be showing you the SWOT analysis regarding PLHIV experiencing HIV-related stigma and discrimination. Let us start to talk on their strengths. When PLHIV had acquired the virus and started taking medication and treatment, they become more appreciative of life. They gradually learned to accept their status and started to empower themselves with the help of pre and post counseling. Practicing safe sex towards their partner, not putting them at risk of getting infected. Some HIV advocates and PLHIV are strengthening other PLHIV experiencing the stigma and discrimination. However, majority of the people living with HIV are still refraining to get the proper treatment, most especially to those newly diagnosed, because it makes them emotionally and mentally weak and being totally incompetent. It is hard to some people to accept their status because they never had an idea that they will be infected of the virus, but because of their unfaithful partners, they have acquired HIV. They started to have negative view of themselves and self-isolation from other people and at work, having low self-esteem and self-efficacy. Knowing that there are a lot of opportunities for PLHIV, there are social hygiene clinics and treatment hub, active PLHIV organizations in the country such as Love Yourself Group, AIDS Society of the Philippines, the Project Red Ribbon, and other support groups for them. That life can be prolonged, living like normal people without HIV with proper treatment and antiretroviral treatment medications provided by the government, but because of the experiences affiliated with stigma and discrimination that hinder them to get these opportunities, there are certain threats that has a huge impact on them. They both grew up in a Christian family. My first interviewee, let's just call him Renan, he was diagnosed with pneumonia, stayed in the hospital for 2 months until they have found out that he's also HIV positive. He had acquired the virus from his ex partner. It was the doctor who told his family about his status. He experienced discrimination from the people closest to his heart, his sister and best friend. His sister strictly prohibited him to visit her and the children, while his best friend bullied and disclosed his status on social media. He never imagined that he will be infected of the virus because he never had sex with multiple partners. It was all due to his unfaithful partner and unaware of his status that time. Prior to having HIV, he thinks differently and negatively toward people living with HIV, that only sex workers and gays having sex with multiple guys can acquire the virus. And now that he's a part of them, those negative beliefs, views, and thinking applied to himself. Same with my second interviewee, Van. He was diagnosed with HIV in January 2016 at the age of 22. When his parents was told by the doctor about his status, they directly tell her to cremate him right away so that the virus won't spread. He is a totally disgrace in the family, being the eldest son and as the role model to his younger sister. He had acquired the virus from his ex-partner as well. He experienced stigma from his group of friends. He had been accused of having sex with random guys, that's why he got infected. He isolated himself from people until he decided to get help with the Project Red Ribbon, been through pre-counseling, taking ARV medications, and post-counseling. He became more appreciative of life, and now he's one of the counselors of the Project Red Ribbon. Based on the data gathered, the interviewees prior to getting infected of the virus have perpetuate prejudice or negative emotions and feelings, stereotyping, which is a group-based beliefs, and discrimination, negative or unjust treatment toward people living with HIV. From the HIV stigma framework developed by Dr. Stephanie Chaudot and Dr. Valerie Earnshaw, it describes how HIV stigma is experienced by individual people living with HIV. They may experience enacted stigma, experiences of discrimination from others in the past or present, anticipated stigma, expectations of experiencing discrimination from others in the future, and internalized stigma, endorsement and application of negative beliefs and feelings about PLHIV and applying them to the self. In their cases, they have experienced internalized stigma and enacted stigma even up to the present from people who are uneducated and unaware of the virus and how it is being transmitted. Therefore, I conclude that no matter what any stigma is being experienced by a PLHIV, it can have a significant impact on affective, behavioral, and physical well-being. It is affiliated with isolation and feeling unsupported, preventing them to be open to others and threaten the effectiveness of HIV prevention and care. I strongly believe that promoting openness and providing education to people, regardless of their HIV status, can fight the stigma present to every individual and community level.